Hello students, we'll discuss an interesting topic today. Look at this, what this instrument is. Look at that. Probably thyroidectomy is done here. Something comes here and there is a suction created by pressure. So there is a lock here. Same thing here, probably mastectomy is done. Modified radical mastectomy, MRM. Again the tube comes here. And it is by pressing suction is created. This is the Romavac or Redivac drain. So this is suction drain. Look at this. This is suction drain. Romavac or Redivac suction. So very typical, very commonly used. Easier to create suction and used in thyroidectomy, used in mastectomy, and used in all surface major surgeries. This suction drain is the standard pattern nowadays. Different sizes are available, sometimes 2 loops are available. Drain is passed through a very strong steel perforating instrument and through that, and it's connected to that. Suction is created by pressing this corrugated, by pressing this tube, this suction tube actually. By pressing this, so it can press and expand. It creates a suction by negative pressure and sucks all fluid. So that is the typical suction drain. Now, why drains are used? To evacuate fluid, maybe blood, bile, pus, lymph, fecal matter, whatever it is. To prevent dead space, that's very important. The deeper cavity, major surgery, and to create a controlled fistula, especially in the abdomen and in thorax also sometimes. That's important, control. GA, after gastrectomy, if leak occurs, comes through the vein. After biliary surgery, after bowel surgeries, it is commonly used actually. It creates a controlled fistula. If it leak happens, then you got a time to think. So other than that, drains can be active, passive. Passive corrugated drain is passive drain. Active, all suction drains are active drain, and it can be open, closed, suction, closed, open, some suction, underwater seal, like intercostal tube drainage is for thoracic cavity, pleural cavity, what you put is underwater seal drain. Drains can be active. All these negative pressures are active. Passive is without negative. Through gravity and capillary action it drains, like corrugated rubber drains by gravity and capillary action. So this is a passive or active. Usually active is used. Depending on the situation, you may use different types. So remember, but I'm not going to detail that, indications and problems of drains. Problems, it may cause erosion, it may cause bleeding, it may get, it may not function, it may get blocked, may not be knowing whether there is any collection inside. Infection can occur, erosion can occur if we keep longer time. It may transmit bacteria into that. So there are so many problems also with the drain. So drain when not functioning, when you think that its function is enough, then drain should be removed. Don't keep it longer than that. That is the concept. So answer the MCQ. What this instrument is, look at that. There's a bulb. Often it is called a grenade. And connecting tube is there, connector. There is a tube. There is a flat, multiple perforated, flat, soft areas are there. So many multiple things are there that draws all fluid. So this, when you press this one, this creates the negative pressure. This creates the negative pressure. Then draws here, then all these multiple areas, it sucks all fluid there. So advantage of this instrument is that we will discuss later. So no, I have to cut this one. Last, 1 minute. This is the MCQ question. I went for detail by mistake. So I'll start from the MCQ. So students, answer this MCQ. What this instrument is? Look at carefully. A. Jackson Prod drain, Redivac drain, C. Sump drain, D. Corrugated drain. Put your answer in the comment box. We'll have a discussion about that once you put in the comment box. Students, go through my clinical methods in surgery and with the video lectures, manual of surgery, detailed textbook, everything is there. Operative surgery 2 volumes, technique, and my DigiNerve surgery lectures covers everything surgery topic, including specialty, instruments, specimens, operative surgery, and images. So students, I hope you understood this one very well. Drains in surgery. Thank you very much.